Hi guys, so I am here with our CosMediTour exclusive surgeon, Dr. Michael Garrity.
Hey guys, how are you?
So we work with Dr. Michael Garrity. He's probably performed about 400 CosMediTour clients. So Dr. Garrity is going to tell us a little bit about study, what you specialize in, and a bit of your background and where you're based.
Well, thanks, Bella. As you can tell, I've got a bit of an accent, so I came into this world in Ireland, and I studied medicine originally in Trinity College in Dublin, Ireland, and then did the surgical basic program between Ireland and the UK, and did some American exams as well, and then about 12 years ago migrated to Australia, and feels like yesterday.
So you've been an accredited surgeon for 13 years?
So I would have gotten my membership of the Royal College of Surgeons of Ireland and the UK exams in 2007. I'm showing my age, but
okay.
There you go.
And so you would say you specialise in breast and...
Look, yeah, breast body really. I have the privilege of working closely with Dr. Geraghty, and probably under his tutelage have developed and evolved my skills. And that would be, I would say would be my area of expertise. So, yeah. Perfect.
So we got about 4 questions most commonly asked from you guys, and then we will answer a couple that are in the comments here. So a lot of people wanted to know about a mummy makeover, what it involves, and how they know what type of tummy tuck or breast surgery they require, what combination.
Yeah. Look, I think it's important to realise this is very much a case-by-case basis. It's not like you can do the same operation for each patient. You really have to be assessed as an individual, and then you deal with the components, be that the breast and the abdomen, and you have to deal with them together really. What type do you have? Again, it's, some people are in a situation where they can have a tummy tuck, so to speak, and a breast augmentation. And then you've got the patients who may need a slightly bigger tummy tuck or an extended abdominoplasty. And then they may also need a breast lift too. And again, that's really on a case-by-case basis. And that's a decision that's made between the surgeon and the patient together, because the aim really is expectation management, and it's the expectation not only of the patient, it's my expectation as well. And as soon as we marry those two expectations together, then that is where you can get a really amazing result.
Okay, perfect. So Emily Wynn has just asked, can you still play contact sport with breast implants?
You can. It's all about the time you can get back to contact sports and the type of contact sports that you play. So ideally, we've got very I won't say strict, but we give advice about what you can and can't do in the post-operative period. Certainly for the first 6 weeks after surgery, we wouldn't be advising any kind of upper body strenuous exercise, because the type of pocket that we like to dissect is very tight, and we like to achieve that very amazing cleavage, so to speak. And if you get back into sports too early, that is a tendency to push the implants apart, and it just kind of undoes some of the good work that both the patient and ourselves has done in that initial setting. So to answer the question, yes, you can play contact sports, and you just got to wait. You just got to wait until everything is healed up.
Wolf Mother has just asked how much for a mummy makeover in Oz. So they typically start at about $19,980. And again, depending on what type of procedure you require. A big question we get asked is what size implants to choose, what size you can go up to, how do you know what size to go?
And that's a That's a good question. And it's funny, I was just on the phone to a patient just before I came on here, and she asked me that very same question. That's one of the reasons why we like to see you in person beforehand. Because at that time, I say we take 4 measurements and 4 photos. And some of the important measurements have got to do with the width of your breast, because then we can determine the size of implant that your body can accommodate. And subtle things exist as well, such as perhaps you have an underlying skeletal abnormality. A little while ago we saw a lady who had a thing called a pectus excavatum, or like a little hollowing in her chest. And if you put a super big implant into that chest, you're kind of predisposing that patient or lady to complications in the future. So again, I'll use that term expectation management, and we try and manage the patient's expectations of what their body can achieve with the implant.
Mm-hmm. And what do you say to clients who will see, looking at before and afters, where they may think they look similar to a before photo, so they want the same size?
Love it. We love that. I'll tell you why. Because it just kind of gives us a ballpark idea of what their expectation is, and also it gives us an idea of the type of implant we need to use. Mm-hmm. So for example, they may see a patient and she was maybe a cup beforehand, and now she's a C cup, and we can say, okay, that's the result we can achieve using this implant for you. So it makes our life easier. Yeah.
Mm-hmm. Perfect. Okay. So a big one as well is if someone has been recommended a breast augmentation with a lift, but wants to know if they can just opt for the breast augmentation alone.
You can, and this comes down to sitting down with us and having a really detailed conversation about the expectation of your result after the procedure. And this is the time and effort that you need to put in before the operation to say, okay, well, what kind of result do I want? Am I happy if my breast is sitting a little bit lower after the procedure? And if you are happy with that, then in that situation, yes, you can use an implant. There is one caveat though. Perhaps in the future you will need a lift, which is fine, and we'd be, absolutely happy to do that. But it comes down to say, all right, this is going to work, this is the result I'm going to get, and I will need a procedure in the future, perhaps to lift the breast up on the implant.
Mm-hmm. And would you say there are some clients who don't necessarily have the choice? They have to go with the lift?
Yes, and I mean, this is our situation where we say, no, we're not willing to offer you that procedure. And we're patient advocates, so we have to advocate for you as a patient or client to ensure that you get the best possible result. And if we feel as though you're not going to achieve the best possible result without doing a lift, I believe we have to say, no, we can't offer you that operation. And then that's something you can revisit on a second consult, and even on an ongoing basis. It's not a decision that's just made, it's a discussion you have, and you say, okay, well, the result is going to be really suboptimal, you need to have the lift.
Mm-hmm. Mm-hmm. And Sky Wins has asked if a donut lift is for areola reduction only.
Yeah. The I assume that the term is, the medical or technical term is a Benelli lift, and that can reduce down the circumference of your nipple areolar complex and get a little bit smaller, and that can have an effect of flattening out the breast a little bit. And the other thing about it is you also have a scar around the nipple too.
Mm-hmm, mm-hmm. And when can you drive a vehicle after surgery?
Depends what kind of vehicle. So if you're talking about a vehicle that's got power steering and the steering isn't very heavy in it, you certainly should be able to go back to driving that after 5 days, that's not an issue. But if you're driving like a heavy duty vehicle that there's no power steering in, and you're using your upper body a lot and it's pushing down on that pectoral muscle, we'd say you probably should stay away from that for at least 3 to 4 weeks.
So we've got a couple of questions that have built up as well.
We're going to get to all of them. Bella's very conscientious.
So is there a restriction in how much fat can be removed from areas? So we actually don't offer that procedure, the Brazilian butt lift. Can you have a breast reduction with an implant?
Yes, you can. And in theory, that's what we say to patients. The implant with a lift, it's like you're doing two opposite things. You're providing a lift, all right, which is in effect reducing some of the breast tissue, and you're also putting an implant in to create volume. So yes, you can do a breast reduction and an implant at the same time.
And Madison Ashley has asked if Dr. Michael Garrity is based in Sydney or the Gold Coast. So he's based in Sydney only at this stage.
That may change.
Yes. Sammy has said, if nothing is wrong with current implants and you're happy with them, do you have to replace them in future?
If you are happy and your implant checks are going well, there is no need to change them. That's a question we get asked a lot. Some people come in, they're like, I've heard I've got to get my implants changed after 5 years. That's not the case. If there's no issue with your implant and you're happy with your breast shape and how they're looking, you just keep going.
So with regards to recovery, when it is safe to exercise, we've kind of touched on that a little bit, but a little bit more info about, when you'll see your full results.
So just to, in terms of recovery, we really like to see our patients wearing their bra and straps for at least 4 weeks after surgery, all the time. The only time you should really be taking those off is when you're having a shower. After that 4 weeks, you can switch into a underwired bra. And you might say, well, why is that? Well, I've a breast implant in front of me. So we put the breast implant behind the muscle. And if you start exercising too early or you take off your bra, the muscle tends to push the implant away, and you tend to get two implants sitting out here rather than close together. So that's why for the first 4 weeks we say, kind of no upper body exercise, and you have to keep the bra on and the straps on all the time.
Even when sleeping?
Even when sleeping. Most important when you're sleeping. And we also say we don't advise you sleeping on your front. So for those people who are front sleepers, we have to say you got to sleep either left or right side or on your back.
We've had 3 questions from Kirsten, Leah and Sammy about fat grafting, and to explain what that is, what that does. That's
a good question. So there are a certain cohort of patients we offer this to. And there are probably the ones we really like to offer it to are those patients who've got a very tight inframammary crease and they may be at risk of a double bubble. And what the fat grafting does is it tends to even out that contour. So when you get a double bubble, you almost have like a little divot. And we put the fat graft in where the divot is and it smooths it out. The other good thing about the fat is it can be used to augment the cleavage lines here in the middle. So what we do, we borrow some fat generally from the inside of your thighs, maybe 10-20 cc's, and then using a special cannula, we inject it into that medial cleavage region. And
can the body digest the fat?
Yeah, so that's a good question as well. So fat take, we say, is probably of the order of 60%. So what does that mean? That means if we put in about 20 cc's of fat, about 7.5 or 8 cc's will dissolve with time.
And when you talk about double bubble, what is that?
So what double bubble is, I suppose the best example is when you try and go too big too early. So for example, if you've got a person who's got a very small breast and they have a tight inframammary crease, and you try and put a very big implant in there, the body's skin isn't able to accommodate it. And as a result of that, you can see a residual contour deformity where their old inframammary crease was. And that's why with that crease, we like to put the fat in there.
Peter has also just asked about if you do have existing wide set breasts, if that can be closed without using implants that are too large.
It can. And this comes back down to the profile of the implants. So the profile and the width. And it's one of the regions where you can consider using a mini profile implant. Now the benefit of the mini profile is you can get a wider implant that doesn't give as much volume. So you're closing the cleavage, but you're not giving that huge boost of a bigger implant. So it's a good question as well.
And Madison Ashley has asked if coming from Brisbane to Sydney for surgery, how long you should stay in Sydney for the post-op, which I believe you're happy to organise that with the client's GP locally if they need to travel back home.
Yeah, so let's do it, say, from a chronological kind of basis. So if you're from Brisbane, we talk to you on the phone, we do a teleconsult with you beforehand. Then we would like to see you face to face, either on the Wednesday or the Thursday, and aim to do your operation on the Friday or the Saturday. In that instance, then you'll probably be heading back to Brisbane after 48 hours. Now, we love to see our patients, so if in that 48 hours you'd like to come into the clinic and see us and see how your results are going, that is not an issue. Even if you go back to Brisbane, the benefit, I suppose, of modern technology now is you have FaceTime and Zoom, and if you'd like to or need to speak to us urgently, we're always available on email and phone too.
Perfect. So we've had a lot of questions as well about payment plans, which through CosMediTour we do offer through a third-party financier, which is TLC. So they are on our website. Leah has asked, is there a perfect CC size for everyone?
Expectation management again. And this is the benefit of having an idea in your head what perfection is, because my idea of what perfect is and another person's idea of perfect is can be slightly different. What I will say is there is a size that after which it's too big, and you bigger implant, bigger problems. And that's why we do the special measurements to see the width of implant that your body can accommodate easily. And again, this comes back to us being an advocate for patients and saying, I know you want to go to that size, but it's not a good idea for this reason, or that reason. And maybe even just saying, no, I'm sorry, this is the maximum size you can go.
Okay, so Madison again has asked about if she will be able to go shopping and eat out, etc., 48 hours after surgery, which I suppose may be different for everyone.
It's a good question. I'll tell you why. So long as you bring somebody else to carry your shopping bags. And again, it comes back down to, you're just walking around, you're not over exerting yourself. And you're not overextending that pec muscle, and you're not lifting anything heavy, you're not reaching up above your head. So if somebody comes with you and they're happy to carry those bags and everything else, it's no problem.
Jamie Lee Murphy has asked about where the scar location is if she does require a breast lift and augmentation.
Okay, that's a good question. It depends on the type of lift you need, but most certainly if we're moving the nipple, you'll need a scar around the nipple, and that's called a periareolar scar. And then also you'll need a vertical incision that extends down from the nipple. And there are some cases where we need to do the anchor scar as well, so you'll have a little transverse incision underneath the breast. Now, the incision under the breast, people don't hardly see them. The incisions that you'll see is the one around the nipple and the vertical one too. And that's why after the procedure, after everything is healed, after approximately 4 weeks, we'd be advising you about scar management during that time.
So you've got, I believe, 2 Motiva brand implants here, which is the brand that you use.
These are them guys. So Establishment Labs, an American company, there's a big shout out for them. This company is based in America. They have a factory in Costa Rica. We've probably been using these implants with Dr. Geraghty for upwards of nearly 4 years now, and we're big fans. One of the things we like about them is the feel of them. The patients are the same. They pick them up and they invariably say, "Oh, I prefer the feel of this to the other implants that we have in the room," because we like to compare and contrast and say that that's the older implant and this is the newer implant, and certainly the feel of this implant is much nicer.
So it's not necessarily that a round is a fake look and a teardrop is a more natural look. No, that's again, there's been some studies on this as well, and I suppose anecdotally what we've found in certain cases when we're removing and replacing implants is we look at the patient and we go, "Oh, this must be a teardrop implant," and then when we take the implant out, we actually find it's a round implant. So a lot of that shape is dependent on the native shape of your breast. And that's, plastic surgeons have been, and cosmetic surgeons have been sat down in a room, and photos have been shown to them to say, okay, does this patient have a round implant or an anatomical? And they didn't get it right all the time. So does it have also to do with the profiling of the implant?
So what we like about these Motiva implants is rotation is not an issue in the first instance. And also when we turn these implants, so when they're flat, they're fully filled, so there's less rippling, almost no rippling. And when you turn the implant on its side, it almost forms the shape of a breast, where most of the implant gel is sitting below the 50% hemisphere. There you go. And also the texturing is what we call nano texturing, so you're not running into those issues you can get with macro textured implants. The other thing that we like about it is it's cut from a single block of silicone, so implant rupture is not really an issue here too.
And Motiva, I believe, have 0 or very little cases of ALCL.
Yeah, to this point there haven't been any reported cases of ALCL. That's that rare form of blood cancer you can get that's been associated with breast implants. And that's not to say in the future some cases may develop, but to this point, over 5 years, there have been no reported cases. And that really is one of the big reasons for shifting over to this implant and patient safety. Remember, we are a patient advocate first and foremost.
So Jamie Lee Murphy has asked if you'll always need the vertical scar if a lift is required.
Yes, most probably always. Now, to really confuse things here, guys, I'm going to say that there's a small percentage of patients who fit into the category of an implant-assisted lift. And you might say, well, what is that? That's where we actually do a special customized dual plane pocket that in effect lifts up the nipple. And what that does is it means you don't have to have the scar around the nipple and the vertical incision. Now that's a very, very small group of patients, and that's why, as I said at the start, everything is on a case-by-case basis. We can't cookie cutter the surgery. We've got to treat you, the individual. We've got to see your photos. We've got to see you in person, and we've got to manage and match our expectations with yours.
And when you say dual plane placement, what do you mean by that?
Dual plane, put simply, is the implant is going behind the muscle. So submuscular or dual plane. The dual plane classification itself just really refers to how much you're releasing the gland off the muscle. And again, that's on a case-by-case basis.
Mm-hmm. MJ has said having one breast larger than the other, would I need a bigger size in one breast?
Great question. And it depends on the volume mismatch. And another reason why we like our friends here, the Motiva implants, is their volumes go up in factors of 20 until you get into the high 300s. So for example, it goes 300, 320, 340, 360. And for the patients where we do notice subtle differences in volume, it's not unusual for us to put, say for example, a 340 in the right and a 360 in the left to try and match those asymmetries. Because our goal when you come off the table is that you are symmetrical.
And there's been a question here about scar management and keloid scarring and how to avoid or manage that.
Yeah, so for those of you out there, keloid scar is a very rare form of scarring, more common in people from the continent. Again, it's all about trying to pick those patients beforehand. So take a previous history of scarring. You know, have you ever had keloid before? Do you have any other scars on your body? Because sometimes what you notice is if somebody has had keloid scarring in the past, they're at risk of keloid scarring again. And again, this comes back to us acting as the patient advocate and saying, well, you're at risk of keloid. These are the kind of things we need to watch out for. It comes back down to some of our surgical techniques and also very, very good scar management in the post-operative period.
So Rochelle has asked about how to create cleavage, and she's worried about having a big gap between her breasts.
Good question. If you have good cleavage before the operation, you're going to end up with good cleavage after. All right, put simply. The challenging cases, the cases we really like, are those cases where we've got to, so to speak, medialize the foot plate. And what that means is, so if your breasts are sitting further out here, is you're trying to shift the whole foot plate medially and fill up this cleavage gap with the implant. And they're the cases where the supplemental fat grafting can be useful.
Mm-hmm. Okay. And we've also had another question about nipple surgery.
Yeah.
So it just says what nipple surgery is offered.
Well, so as regards that part of the anatomy, so you have a nipple and you have a nipple areolar complex. And what the nipple areolar complex is, it's like the brownish colored tissue around the nipple. On Wednesday, I saw a lady who had what we call an inverted nipple, and what that is, the nipple is sitting on the inside, it's not poking out. And there are cases where you can offer a correction of that inverted nipple. And also sometimes what happens is when you put the implant behind the muscle or behind the breast, the nipple itself pokes out.
Mm-hmm. We have had a couple of questions as well about consultations. So you do get 2 consultations prior to surgery, 1 a phone consult, 1 a face-to-face consult. And how long do they go for?
As long as it takes. Mm-hmm. You know, and you know, if it takes more than 1 face-to-face consult to get it right, that's what you have to do. Mm-hmm. Because if the patient is not happy before surgery, I'm not happy. and we shouldn't proceed until everybody is on the same page.
So there will be no fees for more consultations?
No, not certainly not from us, because again, we have to match the patient expectation.
Holly has asked about smoking prior to surgery, when that should be ceased.
Okay. We won't give you the whole stop smoking thing, but specifically for surgery, depends on the type of surgery. So for example, Holly, if you were just having a breast augmentation, we'd like you to stop probably about 5 days before the operation. You might say, well, why is that? Well, the reason is it can kind of impair or slow down wound healing. If you're having a breast implant and lift, we want you to stop smoking 4 weeks before surgery. Anyone say, well, why is that? Well, the reason is we're trying to preserve the blood supply to a very important structure, your nipple, and we're trying to lift it up. And the risk is, if you're still smoking, the blood supply to the nipple can be compromised, and you get a thing where the nipple expires. And we wouldn't be advocating for you if we proceeded with the surgery knowing that you're smoking. So certainly we'd like you to stop smoking at least 4 weeks prior to the operation.
Perfect. I think that's pretty much it for now. There's just one more question about traveling with regards to government restrictions. So I guess it's just really up to the client to keep up to date with each state's restrictions, but you can absolutely postpone your surgery.
Yeah.
For sure. What are your instructions post-surgery?
So there's two important things we got to manage. There's the pain, sometimes discomfort, okay? So I always tell people, please stay ahead of your pain. Keep your dressings dry and intact, okay? And wearing that bra for the first at least 4 weeks is very important too.
Miss Crystal has just asked, when can you sleep on your side post-operatively?
So long as you're wearing your bra and the straps we provide, there's no reason why you can't sleep on your side from day one.
Okay, perfect. So that is really it for now. So we do offer free surgery recommendations. So you can go to the link in the CosMediTour bio. So that will have a link for an inquiry form, which you can fill out to book